to Biotrek Sailing. We're still in Boston, and we're getting ready for extended offshore passage, so I'm getting the medical kit ready, and I thought I'd go over the kinds of things that we think is important for a medical kit. Figure out what kind of medical kit that you need. You need to know how to use your kit. I like to have a list of all numbers, emergency, as well as search and rescue. Have a checkup and get your prescription medicines. And the components of an offshore medical kit. Now there are a few videos out there, not too many, that do have medical kit components, and I'm going to have the links below with some of those medical kits. In most places on shore, you can always find a doctor to help you out, but when you're offshore, you need to have all the supplies that you would want. Helicopters have about a 200-mile range offshore, so you're quickly out of touch. And so it is important to have everything on board that you need, because while you have a satellite phone and can contact a doctor to get some advice, you need to have everything on board that you may need during your passage. On Biotrek, we got our medical kit from the doctor that gave us an offshore medical course, and it's really a very comprehensive kit. But no matter what medical kit you have, you're going to want to customize it for your own use. We have customized it with adding additional equipment such as blood pressure machine, and we also have bought a lot of over-the-counter or OTC drugs, as well as some of the prescription medicines that came with the kit. And we have additional prescription medicines that we've obtained from our own primary care doctor. So what kind of kit do you need to have to go offshore? Larger vessels are required by maritime law to carry full medical kits, but for sailing lots, being prepared is completely up to you. Common sense should prevail, and also having the recommendation from medical professionals. Now, it's not enough to have a medical kit on board, but you also have to know how to use it. So how do you do that? Well, we've taken medical courses. I've taken CPR and first aid courses, and Pierre's taken lots of medical courses. But when we bought Biotrek, we decided we needed to update our skills, and we took a 2-day offshore medical course. That was really fantastic. Well, there are lots of these kinds of courses. Sometimes with boat shows you can find these courses. There are wilderness courses that offer emergency medicine, and there's a number of private companies, and I have some links below of some of those and where you can take these courses. But it is important to know how to use a medical kit and to assess how important a medical emergency is. And it's not always that easy to do the diagnosis, as anyone who's watched House knows.
Stab his heart!
Sats at 75.
Yes, he's suffocating.
If you're wrong,
keep standing there, he's dead either way.
And aside from knowing how to assess an injury or diagnose an illness, rescue swimming skills are also important. We can highly recommend the rescue diver course that PADI Dive Centers offer. So with any medical kit, it needs to be accessible in an emergency. And ours is quite large. We store all of our medical kit in one very large bag. So you do need to get a large bag and decide where you're going to store it. And then each bag has labeled components of the different things that you might be able to need quickly. For things that we more commonly might use, such as Band-Aids or topical anesthetic, we keep those just in the medicine cabinet, so headache pills, those kinds of things. But everything else is in the medical kit. Now, we've stored it in different places, but it's awkward if it's under the bed, having to lift a bed and get it out in an emergency. So where we store our medical kit now is right in the bathroom. We have kind of a floating sink, and so what we do is it's just stored right underneath the floating cabinet for the sink, and it's always an easy reach. Well, one of the coolest places on a boat is in the bilge, but that's not always the driest place. Actually, on Biotrek, our bilges are kept pretty dry. But we do have our medicines, prescription medicine and other medicines, in a watertight container that we keep in the bilge so they're stored cool and dry. Drugs have expiry dates, but those expiry dates are really assuming that the drugs are properly stored. Things happen, so you just need to be prepared for burns, injuries, infectious disease. We're all aware of that now. With COVID going on, to be prepared for people getting sick on. I'm a big fan of lists. We have lists for everything. And what I do is I organize a binder that I keep on the cruise side with all my lists, instructions, and how-to on the boat. And I keep my own copy where I can find it quickly. So what's in those lists? Well, one of the things we have is emergency numbers for our own doctors. So our personal care physician and also doctors in the family that can be reached. All their contacts by email and phone. We also have the contacts for emergency numbers throughout the world. So I've printed out some of those emergency numbers, and that's in the book, because not all countries use 911 for emergency, and so you don't want to be hunting for a phone number in emergency. So I always make sure that the emergency numbers for any country that we're visiting is in that book. We also have the emergency number for the Centre de Consultation Maritime Médicale, the CCMM, which is a French service, which is 24/7 anywhere around the world for medical consultation. And if you've been in the South Pacific, you know that many of those islands are French, and so that's good to have. We also have search and rescue numbers for around the world in our book. So good to be prepared in advance and have all your lists ready, including what to do with the suspicious boat approaching. So the anti-piracy centers are also in our list. Now, before you leave on any passage, you should have a checkup. And when you're having your checkup, ask your doctor for all the prescription medicine. So with our medical kit that we purchased, we did get a lot of prescription medicines, but we showed the list to our doctor and we got some additional medicines in our kit. We don't take prescription medicines without the advice of a professional. And the same is true for all of our crew. So if a crew member were on board and was sick, we would also have a consultation with a medical professional before giving any prescription medicine. All those drugs are pretty expensive and they all have expiry dates. So do I refresh them all the time? Well, I'm always going over them, but I'm not overly concerned about expiry dates. And that's because I've read up on it in the scientific literature. So some drugs have shorter expiry dates than others. And in particular, liquid drugs have a shorter expiry date than pills. But some pills can last a long time. Now, I'm not advocating that you keep drugs way past their expiry date. But if you have an antibiotic on board that's expired by a few months and you need one, I wouldn't panic. And the other thing I forgot to mention is to save space. Sometimes what we do is we will take the medicine out of the box and fold the box and put an elastic around it. And that way, the space is reduced, but we still have all of the information from the container. What is in a medical kit? So there are a couple YouTube videos that will have in detail all the contents of the kit. I'm not going to go over all the drugs that we have on board, just showing you the different packages that we have in our kit. Okay, so now I'm going to show you the contents of our medical kit. Well, on top we have an EpiPen, and this is eye, ear, nose, and throat. And we have things like for throat, antiseptic for pain, eye wash, travel dental kit, Ambisol, which is an oral anesthetic. It's just OTC, over the counter. This is for mouth, some antibiotics for eye infections, nose and ear infections. And again, some of my packages are collapsed inside just to save space. Red, hemorrhage, and hypothermia. Bandages that are hemostatic, they are bleeding, they stop bleeding. Finger osmometer, so to measure oxygen levels. We have emergency blankets for hypothermia, several of them. Stethoscope, gloves, absorbent pads, and some gauze, and a hemostatic cushion. Well, we have lots of packages with bandages. So this one is disinfection bandages and bandages. So chlorhexidine is in the green. They're nice little, they're ampoules which are sealed. So single use. Lots of different types of bandages, elastic bandages, tapes, and more chlorhexidine just in little individual packets. And more chlorhexidine in individual packets. Chlorhexidine is a really great antiseptic. There's the antiseptic skin cleanser. And more bandages. It's a disinfectant spray from France. Specialized bandages. So that's a foam dressing for wounds. We have a spray to stop bleeding. A non-woven fabric adhesive. Some compresses. An alginate type bandage. More gauze. This package is all for skin. Antifungal, antibacterial. Lots of different types of bandages. These Tegaderm ones, they're really great because they breathe and they don't stick to skin. Let's do this one next. It's GI. So GI gastrointestinal, so it's going to be all the anti-diarrhea medicines, and they're actually constipation, OTC, anti-diarrhea. This is for vomiting and stomach burns, and then there's other diarrhea medicines here. So different strengths. And in this kit also is a UTI testing kit, those little strips. These are special meds. So all sorts of things. Some of the antibiotics are here. These are a French type of anti-muscle ache for flu. These are injectable antibiotics, not for anyone allergic to penicillin, and we do have the sterile syringes and instructions for doing injections. Syringes, disinfectants, and xylocaine. So that's going to be for doing just sterile syringes. Betadine, which is a surgical antiseptic. Hand sanitizer. Wow, that was at a premium a few months ago. More chlorhexidine in these really nice sterile packages. And then we have some needles of different sizes. And this is a dermatological antiseptic for nail infections, not to be used for burns. And this is lidocaine. I guess we usually call it xylocaine. I'm not sure if it's exactly the same thing. So that's a topical anesthetic. So if you had to do sutures that you can inject just under the skin. We learned how to inject xylocaine under the skin and sew sutures in our offshore course. The xylocaine so that you can do the suturing without the person screaming. Hopefully. We have surgery and sutures, and I'm just going to show you one thing in this kit. This came with the offshore medicine kit, which is a completely sterile surgical kit with the mat and everything you need for doing sutures. Scissors for cutting off the clothes. Staples for stapling up skin. These are kind of like a clear band-aid instead of putting a suture, where you can tape the skin together, and you can buy these in a grocery store, at least in the US. And more topical antiseptic, which is betadine. That's the one that colors your skin red for surgery. Staple remover. And we have some different types of bandages in here as well. We also have more surgical gloves, surgical masks, and we do have a neck. So if someone fell off the mast, and they weren't sure if they needed neck support, you can use this. We also have one packet specifically with medicines for the dog. And lastly, we do carry a defibrillator, and that's because Pierre likes to play with electricity, so I like to have one on board. Our burn kit is in a separate bag. So one time somebody had rented a bicycle and fell on a gravel road and ripped all the skin off their shoulder. So we used our burn kit for that. So here's our burn kit, and what you can see inside, creams. This is it says cools and soothes, and it's got very quick instructions right on the back. Some creams, bandages. Here's a burn shield with, again, very quick instructions on what to do. And we have additional one in here. Scissors for cutting off clothing. Sterile gloves. Additional burn shields, and smaller packages for smaller burns. So being a great fan of lists, I also have a list of all our medications. I have them listed in 2 ways. So I have antibiotics that we have, and then some of the medicines in the other bags. So in our purple bag, in our pink GI bag. And then I also list the medications by indication so that I can find them quickly. So eyes, ears, and mouth, cardiology, lungs, muscle relaxants, antifungals, solutions for cleaning wounds, allergy, gynecology, and seasickness. So the next job that I'm going to do is I'm going to go to the drugstore and wander up and down the aisles and see if there's anything else that we might want to have, or anything that we need to supplement, something that we used up, and buy them and put them in our sealed container so that we're ready to go offshore. And it's best to get all the medicines that you want in your home country. That way you're familiar with the brands. You can get great medicines in Europe, but I'd rather personally read all the labels in English rather than have to translate from French. So we're preparing everything here in the US before we take off sailing. And we're just waiting for winter to finish so that we can take off and start our round the world trip.